Bismillahirrahmanirrahim. So now the topic the practical we are going to discuss is Weber's test. This test is used to highlight bone conduction defect in a subject. Again, the procedure is somewhat similar to the tuning Rinne's test we had done before. The tuning fork is vibrated and is placed on the vertex or midline of forehead of a given subject whose conduction is to be tested. Now we will ask the subject if he can hear equal amplitude of sound in both of his ears, and then we will interpret the results. The interpretation is pretty simple. If he says that the sound amplitude is equal in both of his ears, that is, he can hear equal amount of amplitude in both of his ears, we will term that there is no bone conduction defect or nerve conduction defect present in that subject. Both of his ears are normal. However, if he or she says that in one of his ears the sound is exaggerated than the other, we will interpret that there is some bone conduction defect in the ear in which the sound is exaggerated. It is noteworthy here that the muscles tensor tympani and stapedius also dampen the amplitude of sound. In conductive deafness, the person will hear exaggerated sound in his defective ear. Because in normal ear, the sound will be masked by environmental noise. However, that will not happen in the defective one. That's why the amplitude will be exaggerated. In nerve conduction, the sound will be heard better in the normal ear because neural activity is essential for hearing. And where the neural activity is defective, the person will not be able to hear proper amplitude of the sound. If the sound is heard better in defective ear, it is because the absence of masking and effect of environmental noise shows conduction deafness in defective ear. If the sound heard is better in normal ear, then it shows that there is nerve deafness in the defective ear. This is a pretty simple principle of this test. However, you will get to know it more clearly when we will discuss it in performing the practical.